Assalamualaikum warahmatullahi wabarakatuh. Let's begin our session with Ummul Kitab al-Fatihah. Okay, Bismillahirrahmanirrahim. So this will be, you've got how many sessions already? Simulated long case. You've got how many sessions before?
Before this, we have long case presentation, real case.
Real case?
Yes.
Someone clerk already, is it? Or?
Yes, already been clerk and we present.
Okay, all right. So how many sessions have you got?
I think more than 5, more than 4.
Okay, all right. What are the cases that you've discussed before?
Type 1 DM.
Yeah, yep.
Diabetes mellitus.
Lagi?
Congenital heart disease.
Down syndrome.
Down syndrome.
Okay.
Variceal zoster infection.
Lagi? Cool. Okay. For this session, has anyone prepared anything? Oh, tak ada.
No.
Okay, all right. It's fine. So the plan is, what I'm planning to do with you all is we do rather sort of like a simulated long case. So again, obviously this is not ideal lah. Medical student, physio doctors, you should be practicing with patient. You should be mingling with patient, learning from them. So your teacher should actually be your patients. So this is ideal. But then so many things are still happening. You can't even go and pray in mosques and surahs easily, isn't it? So what more when we talking about meeting patients and things. So there's so many variables that needs to be looked after. Okay, so how we're gonna go about this session is basically I'm gonna give you a scenario, a situation, the stem, and then what I want you all to do is one by one you tell me what are further questions that you would want to ask. What are further informations that you would want to elicit from the patient? Okay, all right, boleh. Okay, we'll see if we can go. If we only have time to do one case, then we'll do one case. If we have time, then we do more than one case. Again, I don't like to do teaching sessions more than. Ideally, it should be 1 hour lah. I think more than 1 hour is already not good for your brain anymore. Okay, all right. So the scenario is, this is a mother who brought her 5-year-old child with an abnormal movement. Okay, so again, the idea is I want you all to come and ask one person, one type of questioning that you want to elicit. Okay, all right, clear? Boleh? Okay, so we'll go through the one by one by list on my screen here. So the first will be Azri, and then Husna, and then Akmal. Lepas Akmal will be Farihah, and then Hafiza, and then Irshad, and then Afiq. Lepas tu Lina, Isha, Nurishman, and then Nur Afifah. Okay, all right, clear. Azri, what do you want to ask?
Yes, Doctor.
Yep.
First, I would like to ask what brought the mother here to the clinic, and then I would like to elicit a question about pain. Does this boy have any pain that can make him become abnormal movement. Any pain?
Pain. There's no pain.
No pain.
Mother says there's no pain. Why are you asking this?
Because I suspect this patient to have joint problem such
So
as arthritis.
So you're thinking of arthritis causing abnormal movement.
Mm,
Okay, fine. So mom says there's no obvious joint pain.
okay.
Okay, Husna.
I would like to ask the mother to explain more what she means by abdominal movement.
Okay, yes, that should be the first question. Because if someone presented with something, first you need to elicit lah. What the hell is this? What is the abnormal movement? Is it a gait issue or is it something like seizure? Alright. So this is a very good question. Husna,
Yeah.
try and tell me if this is a patient, how would you ask the question in Malay?
Boleh Puan jelaskan lagi apa yang Puan maksudkan dengan gerakan abnormal movement? Apa yang Puan maksudkan dengan tu?
Gerakan tak normal.
The question should be macam apa yang Puan masukkan dengan pergerakan yang luar biasa ni, yang tak normal ni. Apa yang dimasukkan? Cuba cerita sikit. So describe, kan? Okay, so then mother tells that okay, the child was relatively well before, and then the abnormal movement is like abrupt onset of sudden jerky movements. Abrupt onset of sudden jerky movements. Okay, Akmal, what are the further informations?
I would like to ask when the abrupt sudden movement occur. Is it during to start walking or any other activity?
So the child was sitting and then suddenly have this jerky movements. What are you trying to get actually, Akmal?
Tadi apa jerking movement tu during walking, when to start walking?
Sitting. The child was sitting. Sitting and then suddenly have the jerky movements.
Maksudnya dia tengah resting lepas tu dia ada jerky movement.
Tengah duduk cakoh, lepas tu terus dah ada this jerky movements.
I'm not sure tu.
Why do you ask this?
To trigger factor that causing the jerky movement, such as maybe certain people that have epilepsy, they will have the attack during watching television.
Okay. Farihah, next. So,
Berapa lama?
Farihah, give me 1 second. 1 second. I need to sort out something. 1 second. Okay, sorry. Farihah, yes.
Yes. Berapa lama abnormal movement tu berlaku?
Okay, mother will say.
Duration.
Okay, mother says it's brief. Probably less than 5 minutes.
Less than 5 minutes.
Why duration is important? Kenapa Farihah? Why?
Mungkin nak tengok kalau sama ada dia acute atau kronik.
Kronik, masalah ni acute atau kronik. Kronik maknanya apa? Kronik maknanya usually something is more than 1 week, benda macam tu kan. Okay, tak apa, sekejap. Hafizah. Nur Hafizah. Mana Hafizah ni? Dengar tak dengar ni? Mana Nur Hafizah ni? Dengar tak dengar ni? Khabar ke tak ni? Irsyad lah, Irsyad. Hafizah is ignoring us.
So regarding the jerkiness itself, so the complaint is it come with abnormal movement. So I want to know about
Ya doktor.
the
Hello dengar? Hello? Ayo.
Tak apa Irsyad, continue.
I want to ask more about the jerkiness. How regarding the duration? So he said that does the jerkiness happen on the same day,
Same day with what?
which that he arrived at the clinic?
Yes, same day. So after the when the child had this jerky movement, mother straight away brought the child to the clinic.
So during the jerkiness, how about the condition of the patient? Is it the patient sedar ataupun tak masa dia tengah jerkiness tu?
He didn't seem to be responding. Okay, Hafizah, next.
What maksud tadi cakap dia jerky movement kan? Maksudnya yang jerky tu tangan dia ke kaki dia ke tangan belah mana?
Okay, yes. So you need to get more information lah about the jerky movements tu. What type of jerky movements? Is it controllable, tak controllable? Which part is jerky? Is it just the finger yang jerky ke? Is it the whole body? Kan? So get more information about that. Ask the mother to describe. Kan? Describe all the event. Sepatutnya you all, okay, again, bila you dapat satu, when the patient come in with a complaint, the first thing is you clarify the complaint. Describe fully sebelum that event, what was the child doing. Bila onset of the event, apa child buat. Lepas tu bila masa event tu macam mana, suruh mak describe in detail. Each body part. Mata, mulut, tangan, kaki, perut, what happened. Kan? Lepas tu apa parents buat at that particular time. You kena go through all those things lah. Kan? What parents did. Bila anak ada abnormal movement, do you think the mother will just sit still? The mother will do something lah. Kan? So get that information. What did the mother do? Apa lagi features yang you nak tanya pada keadaan baby tu? Pada keadaan children tu. And then go back pula. What are the trigger? Look back. Set the timeline. Faham? Okay, so Hafizah. So the mother answers that, okay, the jerky movement of all 4 limbs. Mother can't control the movement. Okay, let's go to the next. Siapa yang lepas ni? Siapa seorang lagi yang ada kamera? Siapa sebelah Hafizah ni? Siapa nama? Yang duduk dekat kerusi.
Lina
You.
ada.
Nama tak keluar. Okay, fine. Lina. What other things you want to know? I'm not going to give you the history if you do not ask me. Tak dengar Lina. Mute. You are still muted.
Patient ada demam tak sebelum?
Tak dengar.
Patient ada demam tak sebelum ni?
Okay, yes. Okay, so mom says the child has been having this fever, initially low grade, since the day before. And then the fever sort of got more on the day of onset.
Sebelum patient start jerky movement tu, dia ada tak cakap dia nampak like macam
Tak dengar soalan.
patient ada cakap ada bayang-bayang something like sedikit hallucination.
So hallucination before onset of seizure.
For onset.
What are you trying to elicit?
The
Why hallucination before seizure? Are you thinking of things like aura?
Yes.
So aura is not hallucination. It's different. So if you're asking about aura, you should ask, did the child say anything? What was the condition of the child before? Sometimes dia kata macam sakit perut, macam tu. Dia macam nampak cahaya-cahaya. So these are all auras, not hallucination. So aura and hallucination is totally different thing. Okay, Afiq.
Ya, saya.
Yes, what else you want to know? We haven't got far ni.
Sebelum ni pernah kena berapa kali dah?
This is the first onset.
Oh, this is the first onset. Boleh cerita lebih tak pasal rupa dia masa dia kena, selain daripada pergerakan dia? Maksud saya dari segi color kulit dia ke, ataupun perangai dia sebelum tu ke?
No. One question. Which one you want to know?
Ada mata dia nak terbeliak ke atas ke?
Okay. So mata dia nampak pandang ke atas. There's uprolling. Uprolling blank stare.
And then
Okay, tak apa. Fine. Isha.
Yeah.
Yes. What else you want to know? Lepas Isha, Nurisman and Afifah. Think. What else you want to know? What else are the information you need to know for you to formulate your diagnosis?
Lepas daripada, kan lepas dah habis jerky movement tu katanya tak sedar kan. Nampak masa dia tak sedar. Bila dia dah sedar tu nampak macam dia tak fokus ke ataupun dia mengantuk ke, dia macam mana lepas tu?
Can you ask that question again? Your question is a bit confusing.
Anak puan, lepas anak puan dah berhenti dia punya jerky movement tu, keadaan dia macam mana? Dia nampak macam mata dia macam tak fokus ke ataupun dia mengantuk ke lepas tu, ke dia aktif macam biasa je ke lepas tu?
Okay, what are you trying to elicit?
Post-ictal.
Post-ictal drowsiness. Okay, that's fine. The issue is, your first question tu, it's a bit, sebab you kata lepas pergerakan tu dia tak sedar. Actually, during the jerky movement masa tu yang child is unconscious, kan? So the question should be, okay, the child was having this jerky movements. When the jerky movement stops, how was the patient? Was the child straight away alert after that, talking, or is the child sleepy? Macam tu. Okay. So mother reported after the jerky movement stopped, the child seems very sleepy, and then slept afterwards.
Okay.
What else you should ask after that?
Lepas daripada tu ada jadi lagi tak jerky movement ni?
Tak ada. No.
Tak ada. Terus bawa pergi sini lah.
Yes.
Pergi klinik. Okay.
In that line, what else should you ask? In that line. Okay, if you have a child with seizure, okay, the seizure itself, you guys haven't got the full history yet about the seizure itself. Okay, someone need to ask that. And then okay, Isha is asking about the post-ictal event. So post-ictal, there the post-ictal drowsiness, the child is sleepy. So you should ask about when did the child actually regain full consciousness. The child is sleepy. I told you the child seems sleepy after the onset, but is the child conscious? You can be sleepy, but the child is responsive. Faham tak? Because you need to assess whether is the child still having seizure, still having subclinical seizure. Subclinical seizure, there's no movement, but the brain function is not there yet. The child can't respond. There's no eyes, it's not focusing. So if the child is sleepy, can the child respond? Yes. A sleepy child can respond. A sleepy child can still answer questions. If the child may be drowsy, but the child can still respond. The child is still responsive. So the question should be in line of after the seizure stops, after the abnormal movement stops, what happened? What was the condition of the child? When did, and then that post-ictal drowsiness also is for how long? The duration of the post-ictal drowsiness. And then is the child responsive? When did the child actually regain full consciousness? So this is the sort of questioning that you should go. Okay, Isha, you want to repeat your question? You want to reformulate your question?
Tadi Puan cakap anak Puan lepas dia punya jerky movement, masa dia tengah seizure tu dia tak sedar.
Yep.
Lepas dia seizure tu dah habis tu, nampak dia macam mengantuk, itulah dia nak tidur. Tapi Puan ada bercakap dengan dia ke? Dia jawab tak soalan Puan?
Okay. Then mother says she's been calling the child. The child seems to be responsive, answering, calling her name, but seems to be very sleepy.
Lama ke dia tidur lepas tu?
Lama juga.
Berapa lama?
Okay. So the child seems to be awake when they reach the hospital.
Berapa jauh tu? Berapa lama daripada anak tu tidur sampai hospital?
Probably half an hour.
Okay.
Okay, Nurishman. Other information?
Sebelum ni dia pernah ada trauma macam jatuh ke, terhentak kepala ke, main lompat-lompat ke atas jatuh ke?
Tak ada.
Tak ada.
This is a very docile child. Duduk kat rumah baik-baik, duduk bersila.
Dia aktif kat rumah tak sebelum ni?
Aktif.
Aktif lah.
But it's not jumping around.
Sebelum dia kena benda ni, dia ada muntah-muntah ke, pancangan ke, ada tak? Dia ada komplain sakit kepala ke?
Tak ada. What are you trying to elicit, Nurishman?
Any like intracranial pressure, there any lesion in the brain?
Okay, right.
Sebelum ni dia punya selera makan okey tak?
Since the child is having fever, so reduce oral intake.
Reduce oral intake.
Okay, Afifah, your questions.
Nak tanya, waktu jerky movement tu berlaku kan, Puan kata ada up rolling blank stare kan? Selain tu ada benda lain dia tak berlaku? Selain mata terbeliak ke atas tu?
Contohnya apa?
Kalau macam tergigit lidah ke, lepas tu dia terkencing ataupun drooling of saliva.
Okay, alright. So mother says there's no incontinence. Drooling of saliva, yes. What else you want to know?
Biting tongue ada? Tergigit lidah?
Biting tongue ni orang Melayu je tanya.
Oh, tak ada.
Bukan. This is typical Melayu punya question lah. Sebab tu dia masukkan sudu, masukkan benda dalam takut sangat gigit lidah. It's only concerned by Malay. Other culture is not concerned about that. But no.
Lepas tu apa yang Puan buat waktu anak Puan ada jerky movement tu?
Okay, usually mom will say, mom gets panic. She tried to waken her child, but the child doesn't respond. That's it. She just stroked the back of the child, trying to wake the child up. Okay, all right. Back to Azri. Azri, you've listened to all the questions that your colleagues asked. You've listened to some of my information. Anything else you want to elicit? Do you think you have enough information?
Not yet, Doctor. Not yet, Doctor. Okay. So boleh saya tahu yang anak puan ni, dia sebelum dia sebelum dia kena seizure tu, dia aktif ke tak aktif, ataupun dia dah macam dah letih apa semua tu, then dia kena seizure?
Dia less active.
Less aktif.
Anything else?
Okay. Seizure pertama kali buat. Tak pernah kena seizure, tak pernah kena.
Husna, anything else? Or do you think you have enough information?
Sebelum ada jerky, ada you lagi kot.
Apa?
Saya nak tanya macam sebelum jerky movement tu ada tak dia komplain macam ada apa sakit leher ke ataupun dia tak boleh tengok cahaya ke?
Tak ada.
Tak ada. Apa sakit kepala pun tak ada sebelum ni?
Sakit kepala, headache tak ada. 5 years old, it's not easy to get headache. It's not easy to get complaint of headache. What else? Akmal?
Saya nak tanya, sehari sebelum dia kena attack tu, dia demam kan?
Yep.
Waktu demam tu dia ada macam batuk-batuk ke ataupun ada macam nampak ruam-ruam kat kulit ke? Ada rash ke?
Batuk ada.
Batuk ada.
Rash tak ada.
Batuk tu berapa lama dah?
Sekali ya, dengan fever.
Sekali lah. Dia sebelum tu ada macam dia hidung berair ke, sesema ke, sakit tekak ke?
Sesema ada.
Ada.
Sakit tekak tak sure because 5 years old they don't say sakit tekak, isn't it?
Dia kurang makan kan? Kurang makan tu sebab dia tak lalu makan.
Reduce orientate.
Dia reduce orientate tu dia macam sakit, dia susah nak telan ke ataupun dia memang tak lalu?
Tahu dia tak nak makan.
Tak nak makan.
What else?
Ada sesak nafas ke anak? Nampak nafas laju ke?
Tak ada. Breathing okay. What else? Okay, Fariha.
Dia ada mengadu macam lemah dekat otot-otot ke?
Ada? Nope. What are you trying to elicit?
Any neurological lesion?
Okay. Nope. There's none of that. Apa lagi? So, Irsyad. Irsyad, yes.
Okay. So nak tanya berkenaan dengan dari segi urine output dia ada macam mana, berkurang ke?
Okay, how would you ask that question?
Urine output dia 5 tahun kan. So biasanya dia pergi tandas berapa kali sehari?
Dia biasa pergi tandas 3-4 kali sehari.
3-4 kali ya. Selepas dia pada kena demam tu, and selepas pada tu dari segi kekerapan dia macam mana? Kekerapan ke tandas muai.
A better question will be kencing dia macam mana? Macam biasa ke berubah kencing dia? Kerap kencing dia makin kerap kencing ke kurang kerap kencing ke? Mak perasan tak jumlah air kencing dia kurang ke sama ke makin banyak ke? Ada perubahan tak pada kencing dia? So that would be a better question lah. Okay. Alright. There's no changes in urine output. What else? Hafiza. Do you think you have enough information?
Ada muntah ke waktu sawan tu ataupun selepas atau sebelum?
Tak ada.
Tak ada.
What else? Lepas ni kita suruh Azri summarize kan because you are the first, so Azri will summarize this case to us and see.
Ni first time yang jadi macam ni ke pernah jadi juga?
First time. Oh, ada orang tanya dah sebelum ni. First time.
Kejap. Nak tanya anak lelaki ke perempuan dia?
Lelaki.
Oh, okay.
What else? Pergi. Okay, Lina. What else you want to know?
Ada macam anak komplain mata kabur ke?
Tak ada. No problem with vision.
Okay, kalau I nampak dia berjalan macam tak macam bukan orang yang biasa jalan lah. Macam tak normal lah.
No gait problem. Gait is normal.
Gait is normal. Patient ada ambil ubat apa-apa tak sebelum ni?
Okay, why are you asking this question?
Because some medication can cause seizure.
Okay, right. Okay, fine. There's no history of taking any medication. Okay, Isha, what else? What else you want to know?
Anak puan ni tunggal ke adik-beradik? Ada adik-beradik lain?
Ada.
Ada. Adik-beradik lain ada pernah kena seizure macam ni?
Oh, yes. Almost all the siblings has this abnormal movement.
Oh, dia kena bila demam je ke macam mana?
Most of them when they have high grade fever, they'll have these symptoms.
Kalau belah adik-beradik puan ke adik-beradik suami ke ada masalah yang sama juga ke? Bila demam?
Ada, sebelah suami.
Sebelah suami.
What else? Okay, Nurisman. What are the information you want to know?
Sebelumnya ada travel mana-mana ke?
Okay, why are you asking this?
Travel history takut yang tempat macam yang pneumococcus dah. Any like from some country have its like macam a different type of bacteria macam pneumococcal tu.
Pneumococcal kan meningococcal.
Meningococcal.
Masya-Allah. So no history of recent travel. Semua time MCO. What else? Okay, Afifah.
Nak tanya, sebelum ni jalan semua okey, bercara bercakap ke perasaan anak puan lambat daripada yang lain?
Okay, what are you trying to elicit?
I want to ask about the developmental
Okay,
assessment.
so ask properly lah. So the question, because if you ask like that, it is ambiguous. You're asking one by one. So ask about, okay, perkembangan anak macam mana? Okay tak? Ada tak? Maknanya dia sekarang dah 5 tahun. Dia dah pergi tadika. Ada problem tak dekat tadika? Ada tak issue with friends? Can he make friends? We already said this is not the first child. There's other siblings. Kalau anak ni compare dengan adik-beradik dia yang lain, perkembangan dia sama atau tak? So that is supposed to be the question. Okay, fine. Afifah, repeat again the question. Reformulate the question.
Nak tanya untuk anak puan ni, ada kalau dekat tadika dia bergaul tak dengan kawan-kawan dia?
Gaul? Okay je.
Kalau dia punya pembesaran tu sama tak dengan adik-beradik dia yang lain? Ke rasa macam lambat benda?
What do you mean by pembesaran? You are talking about growth or you are talking about development? Pembesaran is growth. Tumbesaran ke pembesaran ke apa? Asking the proper question is important. You know why? Because if you don't ask the appropriate question, you won't get the appropriate answer. If you don't get the appropriate answer, then whatever you present before, it may be something that you pluck out or you assume from whatever you understand. Okay, you want to ask again the question? Macam mana? Macam mana? Okay, Afiq lah, Afiq. How would you ask about development?
Development. First, saya nak tanya macam I want to ask for domain tu gross motor, fine motor. For gross motor tu macam mana macam mana pergerakan ada perasan abnormal ke dari segi pergerakan dia?
There's no abnormal in terms of there's no abnormality in terms of movement.
Doktor, I just want to ask about the pergerakan tadi. Seizure tu macam mana? Dia seluruh badan ke seluruh badan jerking ke ada sebelah kanan dulu ke sebelah kiri dulu, lepas tu dia jadi keseluruhan anggota?
All four, suddenly all four at the same time. All four limbs.
Lepas tu satu lagi, ada pernah jatuh tak sebelum ni? Jatuh.
Ada. I've answered this 3 times already.
Dah jatuh. Okay. Itu juga tak ada.
Siapa yang belum tanya lagi ya? Isha ada tanya, Isha. Nurishman. What else you want to know? So for development, I've told you, but you still are not asking this. So this is a child with many siblings. The first line of thought you should ask things like, is the development similar to other siblings? Lepas tu baru you probe. Faham tak? Kalau you ask satu-satu, you akan jadi penat. Faham tak? Tapi kalau you ask, okay, ini dah anak nombor 13 ke apa? Is the development similar to other siblings? Kalau mak kata similar, okay, you boleh confirm kan? Maknanya by umur 1 year dia dah boleh jalan, by umur 1 year dia dah ada banyak perkataan dia, by 3 years old dah bercakap macam biasa. Macam tu. Kalau mak cakap, no, this child is different, this delay sikit. And then you ask the mother, okay, which part is delayed? Baru you boleh probe satu-satu. Kalau you buat macam tadi kan, tanya, okay, motor macam mana, fine motor macam mana. It will take a very long time for you to complete your history. You won't be focused. I've told you just now, no one actually takes my advice. Sewa juga lah. Okay, tak apa, fine. Nurishman, what else you want to ask?
Development ke doktor?
What else? Apa lagi soalan lain? So the thing is, have you got enough information for you to make a diagnosis, for you to then help manage this patient? What else? What are the other information? Do you think you have enough information?
Sebelum ni pernah masuk ward tak sebab sakit lain?
Okay, no, tak pernah.
Nah,
Why are you asking this?
takut dia ada macam immunocompromise ke, selalu masuk ward ke.
Okay, alright. Have you all got enough information for you if you were to present this case as a long case? Have you all got enough information? You're selalu clucking macam mana?
Dia punya course kan tak ada. Doktor nak tanya. Dalam 24 hours, dia berapa kali dia kena seizure tu? Anak tu kena seizure? Only once lah. Okay.
Okay, guys. What is the purpose of presenting a case?
Find the diagnosis.
To get the diagnosis.
Have I told this to you before? I did.
Yes.
There are 4 objectives of any presenting a case. The first objective is to get to your provisional diagnosis. To sell your provisional, to focus on your provisional diagnosis. What is the second objective?
To rule out differential diagnosis.
To rule out all your differential diagnosis. So in your when you are getting the history, you need to rule out all your differential diagnosis. So what are the differential diagnosis? So benda semua yang differential of this you nak kena tanya lah, kan? Sebab how can you present without you getting the information? So that is why I say the first thing is you need to know that what are the provisional and what are the differential. When you know the provisional and you know the differential, then only you can ask the appropriate question. Then you know what questions to ask. If you don't know what question to ask, sometimes the problem is you don't know the diagnosis. When you don't know the diagnosis, how can you ask the appropriate questions? So in this sort of case, you need to rule out all the differential diagnosis. And I've told you before, how many differential at least you need to have? You need to have at least 5 differential diagnoses. Okay, what is the third objective of presenting a case?
And complication of disease.
Look for complications of the disease because everything in this whole world has its own complication. Even minum air kosong pun ada complication. Nothing in this world doesn't have any complication. Everything has its own complication. So you need to think, what are the possible complications of this problem? What is the fourth objective?
Complication of the medication.
Complication of the treatment. So because treatment, not doing anything is part of treatment. So everything has its own complication as well. So ask about that. So in your line of questioning, you should cover all these 4. You need to ask everything related to your provisional. You need to ask everything to rule out all your differential diagnosis. You need to ask questions relation to your complications of the disease and complication of the treatment. And don't forget, this is just for the main bulk of the HOPI. We haven't gone through, you need to ask questions about, you need to ask systemic review, you need to ask birth history, you need to ask social history, you need to ask, all these things are part of your history. So ask her. So I'm trying to gauge, are you all competent enough to get history? Tu je. Okay, boleh. So next, Afifah tak sampai lagi tadi. What other information you want to know?
Nak tanya yang anak puan ni lahir dulu normal?
Okay, you're trying to ask birth history. Okay, fine. So normal. Lagi?
Lahir normal berapa kilo lahir? Berat lahir.
Tak ingat, 3 kilo something.
Lepas lahir tu ada masuk ward ke ICU ke?
Tak ada.
Tak ada apa-apa komplikasi lah lepas lahir tu. Ada kuning ke?
Nope, none. Is that all?
Lepas tu kalau breastfeed tak anak puan ni?
Okay, breastfeed, yes.
Sampai umur berapa?
Up to 1 year.
Remaja. Lepas tu susu formula ke macam mana?
Formula.
Start makan makanan lembut tu start masa umur berapa?
6 months.
Sekarang diet dia macam mana?
Normal diet.
Dia memilih tak makan?
Nope.
Dia makan macam kita lah.
Macam kita tu, I don't know what kita eat lah.
Maksudnya makan apa yang mak dengan ayah dia makan lah.
Is that all? For birth history, is that all? Is it enough for birth history? You should ask antenatal. Any problem antenatally tak? Mother ada diabetes ke tak? Janganlah terus-terus time beranak. Sebelum beranak tu kena mengandung dulu. Kan? So, is there any problem masa mengandung? Antenatally ada problem tak? Ada diabetes tak? Scan semua normal ke tak? Kan? Janganlah terus-terus beranak.
Nak tanya masa puan mengandung ada masalah tak? Kesihatan?
Tak ada. There's no antenatal problem.
Tak ada kencing manis pun tak ada?
Tak ada. No diabetes. Okay, kita pusing balik. Azri. Tapi Azri, yes. you still kena present Okay.
Yes, betul.
What other things you want to ask?
Immunization budak ni macam mana doktor? Imunisasi dia cukup
Immunization
ke?
Cukup ikut buku.
Cukup ikut buku.
Okay, tak apa. Azri satu soalan tak apa. Sebab dia nanti dia kena present. Husna.
Lepas imunisasi tu ada tak dia macam ada komplikasi lepas imunisasi tu macam demam ke?
Tak ada, no problem with immunization. Very happy vaxxer.
Okay.
What else?
Tu tak dia punya berat dan tinggi sekarang ni? Maksudnya dari segi
berat sekarang ni? Berat sekarang nanti bila time examination kita tengok tak ada apa-apa. Tak ada penimbang ke kat klinik ni? Betul. Akmal, yes. Shoot. Akmal.
I would like to about the past history. Dia pernah masuk hospital, pernah admit hospital ke sebelum ni?
Pernah, soalan dah jawab dah tadi. First admission. Tidur Akmal lah. What else? Keduk layan YouTube.
Jadi sakit apa? Jadi doktor pernah diagnose apa-apa ke sebelum ni? Pernah tak?
Tak ada.
Okay. Lepas tu nak tanya, boleh patah balik hopi tak? Okay, nak tanya pasal boleh patah balik ke hopi tak? HOPI?
Of course.
Ya, nak tanya pasal fever tu, pasal demam. Demam tu dia acute onset ke ataupun dia insidious ke? Hello?
Okay, fever dia start fever initially start low grade day before and then worsen on day of admission.
So dia makan Panadol ke untuk kurang demam dia?
Okay, mom took paracetamol.
Ada check ni tak? Suhu badan kat rumah?
Suhu badan tak ada.
Anak ada yang menggigil malam-malam ke? Getar.
What are you trying to elicit? Huh? What are you trying to elicit? What do you want from this question? Akmal, why? We lost Akmal, is it? Wait, give me 1 second. Okay. Akmal tadi. Akmal tak? Sana. Akmal.
Ya.
Apa tadi soalan? Kita dah habis dah question tadi. Sudah. Okay lah, Fariha. What else? Have you got enough information?
Tonsil dia ada bengkak tak?
Tonsil bengkak by definition lah. Mana ada mother yang bicara tonsil.
Okay. Lepas dia sedar daripada seizure tu, ada tak dia macam jadi irritated, marah-marah atau perubahan dalam behavior dia?
Perubahan sikap. So, perubahan sikap you shouldn't just ask about post-ictal. You should also ask even before. Masa having fever tu, ada tak any changes in his behavior? Sikap dia ada berubah tak? Marah-marah, cepat marah atau menangis banyak. Bila menangis pula tak boleh nak console. Unconsolable cry. Pre and after lah, pre and post. Okay. So there's no irritability. No irritability, no change in behavior. Irshad, what else?
Regarding the post-ictal seizure, selepas dia kena seizure tu, dari segi dia ada menunjukkan macam badan dia lemah, macam hypotonia ke, ataupun ada badan dia jadi paralyzed ke?
Tak ada, nampak the child can still move about.
So dia move macam biasa lah.
Anything else? Lina, yes. It's already 55 minutes ni. 55 minutes you should have got all the history already. What else you want to ask?
Not sure that time.
You're happy with the history?
Doktor nak tanya.
Nak tanya.
Lina dulu.
Tak apa.
Doktor nak tanya, untuk child ni dia ada macam muka dia nampak macam tak sihat ke sebelum dia kena seizure tu? Ada macam dia menggigil ke apa semua tu? Sebelum dia kena serangan seizure tu? Kena sawan.
What are you trying to elicit?
Muka dia jadi pale ke, jadi pucat ke, ada tak?
Just before, ada.
Just before.
Muka dia nampak macam putih sikit macam tu.
Pucat lah, muka nampak pucat.
Just before onset of seizure and onset of the abnormal movement.
Thank you, doktor.
Hafiza, yes.
Duduk kat mana?
Duduk kat Kuantan.
Di dekat rumah.
So you're asking about social history.
Yes.
Okay. Social history, living in a apa lagi? Social history fine, tak apa. Okay. Next. Anything else? Afiq.
Ya.
Apa lagi question?
Social history tadi dah habis ke doktor? Pasal kerja habis ke social history tadi?
Social history case settle lah, maknanya duduk kat rumah. It's not a problem.
Just a hobby.
Terrace house, good electricity, good sanitation, good water supply.
ada bela haiwan peliharaan ke semua ataupun hobi adik tu, hobi dia apa?
Hobi dia apa? Hobi dia tanpa stem. Mengumpul stem. Ada orang mengumpul stem lagi sekarang ni? 5 years old doesn't kumpul stem lah. 5 years old don't even have hobby kan? Kan dia suka main basikal kat rumah. What else?
What else? Tak pastilah.
Nurishman.
Yes.
What else you want to ask? What other further history you want to know?
Not sure, Doctor.
Afifah, Isha, both of you. Anything else you want to know?
Sebelum ni anak puan pernah pergi klinik ke jumpa doktor sebab ada masalah dengan gula dalam darah ke, masalah garam doktor kata tak cukup ke, pernah ke?
Ada.
Ada.
Okay, Azri. You want to try and present?
Ya, Doktor.
You want to try and present?
I will try first. Okay.
Okay, alright. Let's hear.
Bismillahirrahmanirrahim. So I'm presenting this child, 5 years old boy, with an abnormal movement, okay, associated with symptoms of the seizure, such as uprolling eye, jerky movement of the limbs, and also no urinary incontinence, urinary incontinence. And however, in this patient also present with symptoms of URTI, upper respiratory infection, which is sore throat, fever, okay, mild fever, and also runny nose, cough, okay, in this patient. Okay, and then there was no symptoms of meningitis such as neck stiffness and also photophobia in this patient. Okay, and then there was no symptoms of encephalitis such as altered mental status because the child responsive after being called by her mother. Okay, and then there was no headache also to rule out encephalitis. Okay, and then there was no trauma in this patient because the mother denied any history of trauma. Okay, and then there is no symptoms of epilepsy because the seizure, there was no recurrent seizure after the first onset of the seizure. Okay, and then there was no symptoms of metabolic problems because the mother denied of any hypoglycemia and also any metabolic problems in this child. Okay, and then next there was no increase in the ICP in this patient, such as vomiting, headache, and also blurry of vision. Okay, and then so my provisional diagnosis is simple partial seizure secondary to URTI, upper respiratory infection.
Your differentials?
My differential is the first one, seizure secondary to meningitis. Okay, and then seizure secondary to meningitis, and also seizure secondary to trauma. Okay, and then maybe can be due to status epilepticus. Okay, because the patients have seizure, but the seizure is less than 5 minutes. Usually the status epilepticus will be more than 5 minutes.
Status is a condition. It's not a diagnosis. Okay.
Oh, sorry.
Husna, do you agree with Azri?
Agree.
What did he say the diagnosis was? Provisional.
Simple partial seizure secondary to
Simple apa?
febrile seizure.
Partial. seizure. Simple partial seizure
Simple partial.
ke salah?
I think it's simple
Ah.
febrile seizure.
Febrile. Okay. Simple febrile seizure. Sorry.
Uh,
Simple febrile seizure secondary to URTI.
Okay, you have okay. Partial apa lawan partial? Partial what is the
Complex.
opposite?
Complex. Partial generalized. Sorry,
Partial
generalized.
or generalized? So yang ni partial ke generalized?
Generalized.
Oh, generalized. Sorry.
Okay, how do you know it's generalized?
Because
Because
all the limbs affected. Not only half of the limbs are affected.
Okay, satu all four limbs affected lagi.
And then
loss of consciousness.
Loss of consciousness.
Yes.
Yes, when it is generalized, there's always loss of consciousness. Kalau partial jadi macam mana?
Dia
localized symptom.
localized symptoms.
Okay, so this patient, you think is it partial or generalized?
Generalized. Sorry, generalized.
Generalized seizure. Okay. Fariha, you agree with Azri's diagnosis?
Yes, I agree.
What was his diagnosis?
Simple febrile seizure. Simple febrile seizure. With generalized seizure.
Why is it simple febrile seizure? Simple or what is the other one? Complex febrile seizure. So why do you say this is simple febrile seizure?
There's no warning sign.
Kalau ada warning sign cannot be simple.
I'm not sure.
Irshad, how do you differentiate between simple and complex febrile seizure? Give me 1 second. Hello? Okay. Siapa tadi? Irshad, how do you differentiate between simple and complex febrile seizure?
To differentiate, we can differentiate it by in terms of duration. For simple, usually it occur less than 15 minutes, and for complex, it might occur more than 15 minutes.
Okay.
And in terms of type of seizure happen, for in simple, usually it generalized seizures will happen, and for complex, it will be focal seizure. And in simple seizure also
It will be, it can be.
It can be. Sorry. So in simple seizure also during the febrile period, usually it does not recur and only occur once. And for complex seizure, it can recur during the febrile period. More than one episode can occur. And in last but not least, in simple seizure, usually there is no neurologically deficit, and for complex, there will be neurological deficit.
Okay, Lina.
Yes, sir.
How do you differentiate this case with meningitis? Why is it not meningitis?
Because patient does not have symptoms of meningitis,
Such as?
such as headache, neck stiffness, photophobia, and
Vomiting.
vomiting.
Vomiting. Okay, fine. Afiq.
Ya, doktor.
Define febrile seizure.
Febrile seizure. Seizure. There is no other that occur. In which the child has no have any other neurological deficit, and then because there is presence of fever, and then the developmental there is no developmental regression. That's all that I can remember.
Hafizah. Siapa? Ada sama nak Irsyad nak try? Okay, Irsyad. Yes.
So Febrile seizure mean that seizure that accompanied by a fever in the absence of intracranial infection.
Intracranial?
Infection.
Mula dah happy dah.
Intracranial pathology.
Yeah. With absence of any intracranial pathology. Okay. Alright. So febrile seizure is very common. It is very, very common. Okay, if the mom asks, so is there a risk of my child to have febrile seizure again after this? What would you say?
I think they will likely to have more episode of seizure, febrile seizure.
You think?
That's about 30 to 40%.
So if this child has had one febrile seizure, there is 30% higher risk of the child developing another febrile seizure when the child is having fever later on. So 30% higher risk. And 30% higher risk on other siblings as well. So, okay, fine. So febrile seizure is very common. If you have one child with febrile seizure in the ward, this child definitely will come in your exam. This is the sort of case that can come in your theory exam. Probably too easy for theory exam. But for clinical, if you have this sort of patient in the ward, they will definitely come in your exam. Febrile seizure is very, very common. And if you have a patient with febrile seizure, the most important thing that you need to rule out is meningitis. And meningitis is one of the diseases that you need to know in quite great detail as well. So you need to make sure that you've ruled out the diagnosis properly. Okay, I think what I can see here is probably because tak ada patient kan. So the way you ask question, I think it's a bit problematic. You can get the information, but you need a longer time to get what you need. So this is I think this is a problem. Okay, among the problem is why is this an issue other than experience and maturity? I think one of the problem is your provisional and your differential is not that strong. So the moment you hear one complaint, you should list down straight away, ideally 7 or 8 differential diagnoses. And then you go one by one, rule out all the differential diagnoses by one. Okay. Again, another issue is getting your timeline right. What I mean by getting your timeline right is like this. If you have a patient, the complaint why the mother brought the child to the hospital is abnormal movement. So the first thing before you ask further is, what do you mean by abnormal movement? Clarify the abnormal movement. Ask the mom to describe the abnormal movement. How the abnormal movement? Which limbs does it involve? Is there loss of consciousness? And then the duration. What happens? What else happened during that event? Incontinence, conscious level, cyanosis, vomiting, drooling of saliva, the eyes, any abnormal sound, any regurgitation, any pain, the voice, what is the voice, and then duration, and then also what happens after the event. We've discussed post-ictal drowsiness, duration of post-ictal drowsiness, time when the child regain full conscious level, yeah. And then if it were me, I will go back to according to timeline. Okay, the child was the child well before? Is there any other problem? Is there any illnesses on the child before? Okay, kalau mak kata okay dia was well, dapat pula when did the child become unwell? So this case just now, one day before. Okay, so one day before, and then you clarify lah, one day before apa? What happens first in timeline? So mula-mula demam sikit. Demam sikit tu mak ada check temperature tak? Go associated all the associated symptoms with fever. Chills, rigor, kan? Ada cough, runny nose, sore throat. Kalau ada patient boleh cakap. Feeding dia macam mana, reduce water intake, lethargy, boleh sleep at night tak? Kan? Urination dia macam mana, frequent urination, reduce urination, dysuria, bowel symptom, reduce water intake. We don't know whether is it because of appetite or is it because of sore throat. But then is there any other GI symptom? What are other GI symptoms? Diarrhea. Is there any diarrhea, for example? Kan? Any abdominal pain? Kan? And then progress on day of admission. Malam boleh tidur tak? Pagi tu macam mana? Bangun macam biasa. Kan? And then go. Bila onset tu, sebelum onset tu, is the fever spiking ke? Ataupun lepas pada onset of seizure tu, fever dia spiking. Sometimes seizure produces kinetic energy. Kinetic energy produces heat. So sometimes there's high grade fever after the seizure. So is that so? Kan? What did the mom do? Most parents dia panic. Bila dia panic tak ada nak buat apa-apa. So ask the mom what happens after that. Apa mak buat dan sebagainya. So go through in the timeline. And then go through all the differential diagnosis. Meningitis, encephalitis, trauma, bleeding, space occupying lesion, metabolic. So metabolic tadi tak boleh tanya pernah tak pergi check doktor kata gula rendah, pernah tak pergi check kata garam rendah. Susahlah. So ask about feeding, ask about vomiting, ask about diarrhea. Ask about any genital abnormality, for example. Any prolonged admission masa antenatal period. Masa postnatal tu ada prolonged admission tak? Sebab contohnya kalau dia ada CAH for example, dia akan prolonged admission. Kalau male with CAH, genital dia akan jadi nampak normal tapi dia akan ada apa? Kat skin dia. Apa dia? Kalau CAH in female, apa feature dia? Female with CAH, what is the feature?
Hirsutism.
Okay, hirsutism. Yes, lagi? Ambiguous genitalia lah, the most prominent. Kan? Female CAH, ambiguous genitalia. Male CAH, genital dia may look normal. Kan? Tapi apa? What would be the problem in the skin? I mentioned. Dia akan ada hyperpigmentation of the skin. Dekat axilla dia, dekat genital dia akan ada hyperpigmentation. So this is sign of CAH. So CAH is associated with hyponatremia. Kan? So ada prolonged admission, ada macam skin discoloration tak, ada rashes, you've asked about history of travel, things like leptospirosis. Leptospirosis can also cause seizure. So ada yellow discoloration, any involvement in, they went swimming. So history kena tanya macam tu lah. And then development, you need to ask as well development. Development I've told you, kan? The easiest question, the easiest starting point kalau patient yang ada siblings is the patient's development similar to other siblings. Lepas tu you probe satu-satu. Kalau mak kata abnormal, different than others, how different? Which part is different? Baru go through satu-satu. Then go through lah. So intellectual, macam mana? Intellectual mana dia boleh sekolah, dia dah pernah kenal huruf tak? By 5 years old, biasa dia dah boleh count. Kan? Dia dah boleh count to 10. Dia dah kenal some numbers. Kan? You ask about whether the child can recognize colours or not. Know his own name. Kan? So umur berapa dia boleh jalan. Kan? Umur berapa sekarang boleh lari tak? Boleh kayuh basikal tak? Kan? You tak boleh tanya boleh stack cubes tak? Children don't play with cubes. Kan? Tapi itu kena buat lah. Tapi things we can ask those like that. Umur berapa dia boleh jalan. Umur dia dah sekarang, certain children by 5 years old dah boleh baca. Kalau dia boleh baca ke tak. These are indicators of development. So ask the proper question. If you don't ask the proper question, you won't get the proper answer. Okay.
Doktor nak tanya. So untuk development tu kita kena tanya pasal macam kena compare dulu dengan sibling lain. So in case kalau dia kata sama, maksudnya kena go deep lagi lah. Perlu tak go deep tu? Kalau dia kata no problem.
Oh yes. You know why? Because sometimes the whole family is abnormal. The whole family may be abnormal. That's one thing. So but you need to clarify, because sometimes people they just answer because they are sick of you. They want you to go away as soon as possible. So dia kata sama. So you clarify again. What do you mean by sama? Umur jalan umur berapa? Apa boleh buat? So you still clarify. Cumanya kalau you start questioning dengan tanya dulu, okay, jalan umur berapa, apa semua kan. Sometimes banyak sangat benda you nak kena tanya. Sedangkan kalau you dah fokus, mak dia boleh cakap dia delay daripada adik-beradik dia. Then you can ask which part is delay. You can focus on the abnormality. Rather than you listing up. You can be a clerk. Kalau kerani, dia dah ada set of questions to ask. Dia tanya yang tu je, lepas tu dia tick. You can be like that. Or a better clinician ask targeted question. You target your questioning, but you need to get all the information.
Okay, thank you, Doctor.
Okay, so all these things kena practice lah, So again, febrile seizure is very common. You can get this for your man or ski, kan? Kita boleh dapat, bila tak satu patient, anak dia seizure, advice. Give advice. Macam mana nak bagi advice? How would you advise this patient? Lina, if the mom asks you, what to do? What to do, doctor, if my child is having seizure? What should I do?
Jangan panik.
Okay, the first is jangan panik. What else?
Jangan buat yang all the meat, like masukkan sudu dalam mulut ke apa ke.
Okay, yes, lagi?
Lagi bawa pergi klinik.
Apa lagi nak kena buat?
Bawa pergi klinik.
Masa seizure tu kena buat apa?
Oh.
Do I need to put in a special position?
Yes.
Yes.
Lateral position.
Yes, left lateral
position.
Lateral position, left ke right ke tak kisah sangat lah. Kan? Tapi you put in lateral position. Why do I need to put in lateral position?
For the airway.
To secure the airway. Maknanya to make sure kalau ada vomiters, kalau ada apa, it goes out. Secretion, semua dia easily goes out from the mouth. Kan? So put in lateral position. So the first thing is don't panic. Second is put in lateral position. Third is assess conscious level. Make sure the child is conscious or not. Fourth, don't put anything in the mouth. Don't put tongue, don't put finger, don't put spoon, don't put anything. Fifth, quickly bring the child to clinic or hospital. Okay, that is the advice. Okay, boleh lah, sejam lah, penat kan nak dapat history kan. So this needs practice lah, susah juga nak practice kalau without patient kan. Tapi that's the thing, the idea is if you ask me, the most important about clerking is actually differential diagnosis. Because if you don't have differential diagnosis, you will be looking, it's almost like you're shooting in the dark. Tutup mata tembak, kalau ada yang kena. Boleh lah. Kalau you are an AI computer, boleh you tanya standard question. Or if you are a clerk, if you're a nurse, you boleh tanya everything. Sebab checklist. But you all are going to become doctors. So doctors, you need to have more clinical acumen. So clinical acumen tu lah, you need to ask the appropriate question to get an appropriate answer. Again, open-ended question is the best. Maknanya, mak boleh cerita kenapa datang hospital? Sakit apa? Ceritakan apa yang jadi. That's interesting. That's good. Cuma the problem with open-ended question, it depends on it is culturally biased as well. Maknanya, if you ask this sort of question to Singaporean or if you ask question to Western people, UK, Europe, mana-mana kan, they are forthcoming. You tanya sepatah, dia jawab 10 patah. But if you ask Malaysian, our culture is a bit laid back. We are not forthcoming. You tanya 10, dia jawab 1 pun mujur. Kan? So sometimes open-ended but it need to be targeted. Targeted open-ended question. Faham? So you focus, you guide the mother. Ada juga certain daripada kita ni, certain daripada our people ni, they tend to terlebih forthcoming. Dia bukan forthcoming, dia suka bersembang. You tanya something, dia akan cerita tu, lepas tu dia akan pergi ke langit, dia pergi makan durian, apa semua benda kan, dia pergi lain. So you need to know how to re-guide, pull back the storyteller and get to your target. Because why? Because you don't have enough time. You don't have, now it's already 1 hour 20 minutes. You don't have 1 hour 20 minutes to clap. How many minutes do you have for clacking?
20 minutes.
So the whole, if you in exam you have 1 hour for clacking kan. Tapi you cannot use those total 1 hour for clacking. Kan? You need to have time for physical examination. You need to have time to think. You need to have time to formulate, to write and think. So ideally you clap for around 15 to 20 minutes. Not more than half an hour. So should be by 20 minutes tu you dapat dah everything. So next 10 minutes tu for you to clarify balik apa history yang you may be miss. And then another 20 minutes for physical examination. 10 minutes for you to formulate and write things. Even that is not enough. So ideally 15 to 20 minutes for you to get history in detail. So this cannot come without practice. Cannot come without practice. So I was trying to get this to get you practice clacking and asking questions. So you can present, because the thing is, it's not just about assessing your ability to present. So kalau you present, sometimes you kelak macam mana, lepas tu you buat cerita je. Kan ada student tu. Kan? Dia kelak tak apa-apa, tapi bila dia present, dia buat cerita lah. Cerita. Dia pandai sembang. Kan? Cerita. Tak apa-apa cerita. Bunyi macam best lah. Tapi if we sit down bila dia kelak, actually cloud dia punya clacking dia. So I think the capability of clacking is as important, if not more, than ability to present. But the thing is, good presentation is biased for the listener as well. I give you an example. This is my usual example. Contoh macam nasi lemak. Ada sesiapa tak suka makan nasi lemak? Semua orang suka makan nasi lemak lah. Orang Malaysia kalau tak suka makan nasi lemak ni pergi keluar Malaysia lah. Kan? Orang Malaysia semua suka makan nasi lemak. Okay, my point is, kan, cuba you imagine ada satu orang tu dia masak nasi lemak, you tahu dah dia punya nasi lemak dia memang gila-gila sedap. It's the best nasi lemak in the whole wide world. Kan? Tapi dia letak bungkus dalam plastik air tu, letak dalam tu, campak, lepas tu ikan bilis pun campak macam tu, sambal pun scoop, pop, letak macam tu. Lepas tu ikat macam tu. Nampak menyelerakan tak? You rasa nak makan tak? You tahu memang sedap, sure. Tobat lillah memang sedap. Tapi dia main campak macam tu. Telur pun pelepak macam tu je. You nak makan tak? You tak nak makan sebab dia, walaupun you tahu it is proven fact that it is tasty. Kalau you buat meta analysis ke apa ke, you tanya, you buat RCT for example kan, semua memang it is double blinded proven that this nasi lemak is tasty kan. Tapi kalau presentation dia tak nice, you don't want to even try the first time. Faham? Tapi you pernah makan nasi lemak kat hotel tak? Pernah makan nasi lemak kat hotel? Sedap tak? Sedap tak?
Tak sedap.
Tak sedap.
You tahu dah tak sedap. It is proven. You tanyalah semua-semua orang yang pernah makan nasi lemak kat hotel. Semua orang akan bagi tahu nasi lemak kat hotel tak sedap. Kan? Tapi are you interested to try that nasi lemak?
Yeah.
Kenapa? Sebab dia letak cantik-cantik, lepas tu dia ada warmer kat bawah dia kan. Nampak you buka tudung dia nampak berasap kan. Nasi dia pun semua seketul-seketul, nasi dia pakai beras basmati super Pusa 1911 tu kan. Lepas tu berkilat-kilat, shiny nampak nasi dia, ada bau dia kan. Lepas tu sambal dia, you tahu dah sambal dia memang tak sedap ni, gila-gila. You tahu dah, tapi sambal dia letak dalam bekas dia pun cantik, ada ni kan. Dia punya telur pun ada tukang buat telur, tapi telur dia sama je telur ayam kan, bukan telur naga ke apa kan. So, sama je, tapi you know dia tak sedap, tapi sebab presentation dia menarik kan. You want to try and you gonna repeat trying that even though you know it is not good. So sama macam presenting a case. Nampak tak? Kalau your presentation has everything it needs to be a good presentation, has everything, semua history semua complete cukup, tapi ke atas, kepala kat bawah, kaki ke atas, ekor kat depan, semua ke atas ke bawah, lepas tu English pula semua daripada awal sampai hujung English berterabur kan, semua pronunciation tak betul, lepas tu tambah-tambah bahasa Jawa sikit dalam tu kan. So walaupun everything is complete, but people will get stressed listening to you. Your examiner will have seizures listening to you. Habis exam tu terus seizure kan. Tapi kalau your presentation is good, very good command of English, your language is good, ada intonation, ada good intonation. Bila important points you go slower pace, less important point a bit faster pace, muka confident, ada eye contact. History sikit-sikit tak cukup pun you sometimes you subconsciously allow it. Faham? So this is human nature. So sebab itu you need to practice as well. Practice presenting. Okay, among the ways saya nak bagi tahu, you all sebab I think it's pity lah. You all don't have much clinical time with us. Among the skill that I want to tell you to practice, among the way you can practice is you try present to yourself. For example, bila you present to you don't have enough time to present cases to your lecturer. Especially sekarang ni you because you can't clerk patient, so it's difficult for you to present cases. Unless kalau you boleh you boleh pinjam case write up daripada previous group ke, and you can present that as a clerking kan. So the point is bila you present, what I can suggest to you is actually record your presentation. Record your presentation and then listen back to yourself. Sebab the moment you listen back to yourself, baru you boleh okay, when I present, the way I say this is very unclear, it's very ambiguous. I need to change how I word my sentence. I didn't say this properly. I also don't understand what I'm trying to say. Faham tak? So sometimes listen back to your presentation. It will definitely help you. Okay, alright. I think that's all. Anything else? Any burning question? I'm sorry if this is a bit different from other lecturers, but I don't care. Any question?
Saya nak tanya kalau ada neck stiffness tu dekat budak. Yang budak 5 tahun macam ni.
Tanya mak lah. Okay. What are the features you can see kalau patient ada neck stiffness?
Tak boleh pusing kiri kanan.
Restricted mobility of the neck kan? So ada tak pergerakan kepala dia okey tak? Ada macam nampak dia macam sakit tak leher dia? You can ask like that. Ada tak nampak macam dia bila dia gerak leher dia nampak macam sakit? Bila panggil dia, instead of pusing kepala, dia pusing satu badan dia pusing. Kan? Ada tak
kalau
macam tu?
Kalau fotofobia pun tanya mak jugalah. Macam nampak silau tu dia mata tertutup macam tu.
Ada tak nampak macam dia silau, dia suka duduk, biasanya budak-budak dia suka ada light bila dia tidur for example kan. Ni dia nak everything is dark. Dia tak nak keluar rumah, tak nak ni. Ada tak macam tu?
Okay, Masuk doktor.
Anything else?
Doktor, time seizure kan, kenapa kita kena tanya dia ada macam rolling of eye, rolling of saliva, lepas tu urination semua?
Why do you think? So kita nak clarify lah whether is this seizure or not. And then seizure dia ada different semiology. So bila kita nak, sebab contohnya if the child has another seizure later on, so you need to ascertain lah whether is this similar seizure ke tak. What's the difference? So seizure ada dia punya semiology, ada dia punya symptom sekali dengan dia punya seizure tu. So these are the things that you need to ask lah.
Oh, contoh kalau dia
And then bukan just rolling eyeball. You need to remember kalau dia ada space occupying lesion, what can happen to the eyes? Dia akan ada sun setting kan. Sun setting ni maknanya dia boleh nampak dia punya apa ni. Bawa mata putih belah atas ni, dia boleh nampak. So this is sun setting. So sun setting is a sign of increased ICP, space occupying lesion. Okay.
Alright.
Okay. Okay. I think that's all. I hope it stimulates you to read back a bit about fibra seizure, and at least think about making questions. Okay. Let's end the session with tasbih kafarah and surah.